examination, we must evaluate the facial symmetry. Are any areas of the facial swelling present? Inspect the skin. What is the texture of the skin? Are any lesions present? Inspect the eyes. Is there any evidence of conjunctival inflammation or other lesions? Evaluate eye movements. Are the eye movements normal? Inspect the nose. Are there any symmetries? Is there any discharge? Lymph node examination. The lymph nodes in the head and neck area should be palpated gently to look for tenderness and enlargements. Normal lymph nodes are either not palpable or you may feel a lymph node that is the size and shape of a small pea. These are mobile and non-tender. Abnormal lymph nodes are generally larger, fixed, and may be tender. If there are any abnormalities present, the number, size, consistency, tenderness, mobility, and location should be noted in the chart. Tenderness of the lymph nodes usually indicates inflammation or drainage of infection. Examination of the neck. Palpation of the structures of the neck can be performed most efficiently when the clinician stands behind the patient. Palpate the sternocleidomastoid muscle, the midline structures of the neck, and the cervical lymph nodes. Palpate the submandibular area. Instruct the patient to tilt his or her head back slightly and carefully palpate the submandibular area. Palpate the submental area. Instruct the patient to bite together tightly and place the tongue into the palatal vault, thus tensing the myohyoid muscle. You can then palpate the submental soft tissues against the muscle. Palpate the temporomandibular joints. Using light pressure, place your fingers just anterior to the tragus. Instruct the patient to slowly open, close, and move the mandible from one side to the other. Palpate the parotid salivary glands. Using light pressure, place your fingers at the angles of the mandible over the parotid glands. Normal parotid glands are usually not palpable. Before doing the oral examinations, you must first have the basic instruments that are needed: the mouth mirror, the explorer, the cotton plier, spoon-shaped excavator, and the periodontal probe. Intraoral soft tissue exam. It is important to record if the soft tissue is within the normal limits or not. If abnormalities are present, we must note the type of abnormality, size, color, location, surface texture, and consistency. To examine a patient's oral soft tissue, a good light is needed. We must first assess the lips. Vermilion. Look for even coloring symmetry and sharp demarcation between the skin and the lip vermilion. Record if there are any abnormalities, such as hyperkeratosis, ulcers, or pigmentations. Check the corners of the mouth, where redness and small fissures may indicate angular cheilitis. Labial mucosa. With the mouth 3/4 closed, gently grasp the lower lip between the thumb and the first finger of each hand and invert the lip. These can be done to the lower lip and then the upper lip. Record any abnormalities of the labial mucosa, such as polyps, scars, or ulcers. Scars inside the lower lip are seen frequently as a result of trauma as a child. Buccal mucosa and vestibular mucosa. Use two mirrors to retract the buccal mucosa on one side. Tilt the head so that the light shines directly onto the buccal mucosa. Examine the buccal mucosa in the maxillary and mandibular vestibules. Move slowly from the posterior buccal mucosa to the anterior and examine the mandibular anterior vestibule. Continue your examination on the opposite buccal mucosa and vestibules. Then move the maxillary vestibule. The mucosa should be smooth, moist, and shiny. For any abnormalities, note the type of abnormality, size, color, location, texture, and consistency. Hard and soft palate. Using a direct vision and dental mirrors, examine the hard and soft palate. Record any abnormalities or variations of normal. A red velvety appearance of the palatal mucosa beneath a denture may indicate denture stomatitis. A bony swelling in the midline of the hard palate covered with normal mucosa is likely a palatine torus. A soft tissue swelling on one side of the hard palate may be an abscess or tumor. The shape, location, consistency, color, and duration will help you with the diagnosis. Oropharynx and fauces. With the patient's tongue in a resting position, have the patient open widely and say, "Ah." This will allow visualization of the oropharynx and fauces. If not, place the mirror on the tongue and gently press inferiorly and anteriorly while having the patient say, "Ah." This depresses the tongue so that more of the oropharynx, fauces, tonsils, and uvula can be visualized. This will also stimulate the gag reflex. Be sure to look at these areas when the patient gags so that this step doesn't have to be repeated. You should look at two folds of tissues that lies on the sides of the throat. These folds are called the tonsillar pillars or fauces. Between these folds are the palatine tonsils. The posterior pharynx, wall, and the uvula commonly may have slightly raised pale yellow areas. These are called lymphoid tissues. The tongue. Only the anterior two-thirds of the tongue is in the oral cavity. The posterior one-third cannot normally be seen on dental examination. Examine the dorsum of the tongue first. Inform the patient that the sides of the tongue will be examined and these may stretch the tongue slightly. Have the patient protrude their tongue and grasp the tip of the tongue with 2x2 gauze. Gently stretch the tongue to one side and visually examine the lateral border of the tongue. The foliate papillae are multiple small vertical folds in the posterior of the lateral oral tongue. Accessory lymphoid tissues may be present in this area that appear slightly yellow in color. These are called lingual tonsils. If there is any abnormal swelling or ulceration, then palpate this area. The tissue in this area should be soft. The opposite side of the tongue should be examined in the same way. Remove the gauze from the tongue and have the patient lift their tongue so that the ventral tongue can be seen. Prominent veins are often visible on the ventral tongue. Particular attention should be paid to the lateral borders of the tongue and the floor of the mouth, as malignant disease develop in these mucosal sites more frequently than the dorsum of the tongue or the palate. The floor of the mouth. Examine the floor of the mouth using direct vision and mouth mirrors. The tongue may have been retracted with the one mirror while examining the posterior floor of the mouth with the other mirror. Openings of the right and left submandibular ducts, or also known as Wharton's duct, are found on either side of the lingual frenum into the anterior floor of mouth. Bimanual palpation is used to feel the soft tissue structures in the floor of the mouth. Place one index finger of one hand in the floor of the mouth lingual to the molars, and place the index finger of your other hand on the skin medial to the patient's mandible. Inferior to your intraoral index finger, using a gentle up and down motion, palpate the submandibular gland and move your fingers forward to palpate the sublingual gland and floor of the mouth. The sublingual gland usually feels ropey or lobulated. Presence of salivary stone in this area would feel hard. A salivary gland tumor would usually feel like a firm, oval, or round mass. This examination should not be painful, but it is slightly odd feeling, so the patient should always be informed before starting this examination. The overall appearance of the gingiva should be noted to be within normal limits or abnormalities noted, such as generalized or local swelling, erythema, ulceration, or bleeding. A gingival graft typically appears as pale, demarcated area of the attached gingiva. The gingiva is firmly attached to the alveolar bone and is continuous with the movable alveolar mucosa at the mucogingival junction. The maxilla and the mandible should be palpated to check for enlargements, such as exostosis or tori.